The outbreak of the coronavirus already impacting airlines around the world. Joining us right now is Sara Nelson, International President of the Association of Flight Attendants. Good morning to you, Sara.
Good morning.
Tell us sort of, to the extent you can, what impact this is happening, what the feeling is among your world.
Well, flight attendants are on the front lines of any communicable disease outbreak, and so we are very attentive to what's happening around the world. We have called upon all of our airlines to take precautions, starting with giving crews the most current information and making very clear what they should be on the lookout for. Of course, with this particular virus, we're very concerned that asymptomatic infected persons can spread the disease. So airport screenings and any lookout for any symptoms on the flight may not necessarily protect people from this. So we need to be very clear about who is traveling from Wuhan or other infected areas, be on the lookout, and also provide flight attendants with gloves and masks and protective equipment.
Is there anything specific that you would do for, if you're going to do it for attendants, that you should be doing for passengers?
Well, let's be very clear that our recommendations to the airlines is that there are enough gloves and masks for those who need it on the flight. So that's all of the crew members, any medical personnel who may assist us during the flight if necessary, and any passengers who may start experiencing symptoms. We would also recommend that if you are sick, stay home and don't fly. And when we find that there has been an infected person on any of our flights, then we need to lock that down. We need to be in communication with the crew members. We need to get them into isolation and get them all the support that they need to live through the incubation period.
Sara, unfortunately, unlike SARS, it appears that, from what we're hearing, you can have symptoms or you could actually be able to pass this along without showing demonstrable symptoms. And how much of a game changer is that?
Well, it's very concerning because, for instance, with Ebola, you could not pass the disease unless you were actually experiencing the symptoms. So airport screenings and being vigilant on the flight to look out for any of these symptoms was a good way to try to understand when you may be affected. That's why we've been very clear with airlines that they need to be they need to have enough gloves and masks for flight attendants to wear on these flights in and out of infected areas so that they can protect themselves, even though we may not be seeing signs of symptoms on the flight.
Sara, tell me about the air on the flight. Is it recirculated? How does that work? If there's somebody on that flight, on a flight, who's got it, does the air system of the plane actually mean that a lot of people on that flight could get it?
Well, typically, this is passed through direct contact. So the air circulation is certainly concerning, but what's most concerning is the people who are having direct interaction with the infected passenger. That would be the passengers who are directly around them. And also, think about it, the crew is going through and delivering food, picking up food, taking rubbish from passengers. And so the crew is very much on the front lines here. And that's why the crew members need to have gloves and masks and protective equipment to be able to protect themselves.
Sara, I don't want to overstate the case. Do you think that passengers should wear masks?
Well, passengers who are experiencing any sort of flu-like symptoms or the virus-like symptoms should be wearing masks, absolutely. And that is one of our recommendations to the airlines, is to have enough masks on board so that flight attendants can provide those to passengers who may be experiencing some symptoms.
And then in terms of screening at the airports, are there particular airports that you think are more significant in this or more at risk, if you will?
Well, any airports that have passengers who have been traveling from infected areas, specifically Wuhan, but also now we have cases around the world. So the major hubs are already conducting screening, and that's very appropriate. We also need CDC to be thinking about air travel more directly and working directly with our union. What we find is that the recommendations focus in on the airports, focus in on how to handle this locally when the disease has occurred, but not giving real specific instructions to the airlines. That's why the airlines are actually doing more than the CDC is recommending right now, because we have experience in the past, and those of us on the front lines are working together to make sure that we're doing as much as possible to spread good information, contain what we can and take preventive measures.
Are you confident that you're going to get enough masks? What do you think is the response from the airlines? I assume they're working on it?
One of the things that we're having to do is to encourage crew to pick up their masks at their base here in the U.S., because what we're seeing is a run on masks and gloves in the affected areas around the world. So we're encouraging people to make sure that they are picking up their own masks and not necessarily counting on the fact that airlines have said they're going to provision enough on the planes in case those are needed or taken by someone else who is very concerned about having that equipment themselves.